Spinal cord originates from which part of the brain? Cerebellum, medulla, pons, cerebrum. र यसको करेक्ट आन्सर छ बी मेडुला. Which finding suggests that the patient's intracranial pressure is increasing? No changes in BB. Systolic pressure decreases and diastolic pressure increases. Systolic pressure increases and diastolic pressure decreases. Apical heart rate is greater than radial pulse. र यसको राइट आन्सर छ सी. Systolic pressure increases and diastolic pressure decreases. Which symptoms indicate serious head injury? Post-traumatic severe headache, post-traumatic disoriented, post-traumatic serous drainage from patient's ear, post-traumatic holding of head with his hands. र यसको करेक्ट आन्सर छ सी. post-traumatic serous drainage from patient's ear. The discharge device to the patient with permanent colostomy, low residue diet, periodic dilation of stoma, limited activity, stool softener. यसको करेक्ट आन्सर छ बी. periodic dilation of stoma. The term nearsightedness is used for presbyopia, amblyopia, myopia, hyperopia. And the correct answer is C. myopia. What does the term arrhythmia mean? The medical term of heartbeat, irregular heartbeat, lack of heartbeat, slow heartbeat. इसका correct answer is B. irregular heartbeat. Where should the hands be placed to perform chest compression on an adult? On the lower half of the breastbone, in the center of the breastbone, on the upper portion of abdomen, on the upper half of breastbone. इसको correct answer is A. on the lower half of the breastbone. The best position for the client in shock is prone, on the back with legs elevated, supine on his side with his neck extended. इसको correct answer is B. on the back with legs elevated. Sterilization is the process used for killing pathogenic microorganisms, destroying all microorganisms including spores, cleaning surgical instruments, disinfecting surgical instruments. र यसको करेक्ट आन्सर छ बी. destroying all microorganisms including spores. Which of the following client can give an informed consent? 10 years old child, client in coma, hypertensive client, mentally ill client. र यसको करेक्ट आन्सर छ सी. hypertensive client. While examining abdomen, which of the following sequence of examination is appropriate? Inspection, palpation, auscultation and percussion. Inspection, auscultation, palpation and percussion. Inspection, auscultation, percussion and palpation. Inspection, palpation, percussion and auscultation. र यसको करेक्ट आन्सर छ सी. inspection, auscultation, percussion and palpation. A nurse is assessing a client with respiratory disorder. Which of the following objective data of the client she has been assessing? Chest pain while coughing, bluish discoloration of nail bed, loss of appetite, lack of sleep at night. र यसको करेक्ट आन्सर छ बी. bluish discoloration of nail bed. Foreign body in throat indicates tachycardia, hemorrhage, prominent vein in legs, inability to speak. र यसको करेक्ट आन्सर छ डी. inability to speak. All colors should not be given with sulfonamides, clonidine, reserpine, metronidazole. यसको करेक्ट आन्सर छ डी. metronidazole. All the following cross placenta except warfarin, heparin, phenydione, morphine. र यसको करेक्ट आन्सर छ बी. heparin. Ducts of Bellini are found in liver, intestine, medulla, kidney. The correct answers are D. kidney. The normal specific gravity of urine is 0.980, 1.000, 1.010, 1.025. The correct answers are C. 1.010. Sensory spot in ampulla is called macula, otolith, crista, organ of Corte. इसका correct answer is C. crista. Which of the following hormone requires zinc for synthesis? Aldosterone, insulin, thyroxine, oxytocin. र यसको करेक्ट आन्सर छ सी thyroxine. When the initial stimulus produces a response that exaggerates the stimulus, the mechanism is called extrinsic regulation, positive feedback, auto-regulation, negative feedback. The correct answer is B, positive feedback. In the context of psychological disorders, APD stands for anxious personality disorder, arousal paraphilia disorder, antisocial personality disorder, antagonistic performance disorder. Let's go correct answers are A, anxious personality disorder. When the medication is given before meals, it's called PCACOD-BD. र यसको करेक्ट आन्सर छ B, AC. In a certain code system, MART is coded as 2914. In this code system, HIMAL is coded as 56294, 89249, 31498, 89293. र यसको करेक्ट आन्सर छ 31498. यो चाहिँ कसरी गरिएको छ भन्दाखेरि चाहिँ A लाई 1, B लाई 2 गर्दै गइरहेको छ है. अनि त्यसै गरी जुनमा चाहिँ अब 2 नम्बरिङ आउँछ नि, जस्तै गरी M चाहिँ हाम्रो 13 मा पर्छ भने त्यो 13 लाई चाहिँ 1 + 3 गरेर 4 गरेर त्यसरी गर्दै अनि यो चाहिँ उल्टो पछाडीबाट चाहिँ यसको गरिएको छ. उल्टो गर्दाखेरि चाहिँ 89413 आउँछ भने पछाडीबाट गर्दाखेरि चाहिँ 31498 चाहिँ आउँछ. If selling price is double, the profit triples. Find the profit percent. A 66 into 2 by 3, B 100, C 105 into 1 by 3, D 120. र यसको करेक्ट आन्सर छ B 100%. Evaluate 2.39 square minus 1.69 square by 2.39 minus 1.61. 2.39 square गर्दाखेरि चाहिँ 5.7121 आउँछ अनि 1.61 को स्क्वायर चाहिँ 2.5921 आउँछ अनि यो दुईटा माइनस गर्दाखेरि चाहिँ 3.1211 आउँछ भने 2.39 minus 1.61 गर्दाखेरि चाहिँ 0.78 आउँछ अनि यसले चाहिँ 3.1211 लाई चाहिँ 0.78 ले चाहिँ हामीले डिभाइड गर्दाखेरि चाहिँ हाम्रो 4 आउँछ. त्यसैले चाहिँ हाम्रो आन्सर चाहिँ 4 हुन्छ. Choose the figure which is different from the rest. A1, B2, C3, D4. र यसमा चाहिँ 4 पिक्चर चाहिँ डिफरेन्ट छ किनभने 4 मा चाहिँ हाम्रो रेक्टेंगल रहेको छ. त्यही भएर यसको आन्सर चाहिँ 4 हुन्छ. QSUWY ए पछि चाहिँ कुन आउँछ त BDCE र यसको आन्सर छ C किनभने हाम्रो चाहिँ यसमा चाहिँ बीचको जुन एउटा चाहिँ हटाउँदै गएको छ. जस्तै Q पछि R छैन, त्यसपछि S छ, T छैन, U छ, V छैन, W छ, X छैन, Y छ, Z छैन, A छ, A बाट B छैन, C छ. भएर चाहिँ यसको आन्सर चाहिँ हाम्रो C हो. Arrange the words given below in a meaningful sequence. 1. Presentation, recommendation, arrival, discussion, introduction. 53412, 35421, 35142, 53124. र यसको करेक्ट आन्सर छ C मा चाहिँ 35142 छ र फर्स्टमा चाहिँ हाम्रो अराइभल हुन्छ, त्यसपछि इन्ट्रोडक्सन हुन्छ, त्यसपछि प्रेजेन्टेसन हुन्छ, त्यसपछि डिस्कसन हुन्छ र रिकमेन्डेसन आउँछ. A is B's sister, C is B's mother, D is C's father, E is D's mother. Then how is A related to D? Grandfather, grandmother, daughter, granddaughter. A र A चाहिँ D सँग चाहिँ granddaughter को रिलेसन छ. Antitubercular drug which causes optic neuritis is ethambutol, rifampicin, isoniazid, pyrazinamide. र यसको करेक्ट आन्सर छ A, ethambutol. The umbilical cord contains 2 arteries and 2 veins, 1 artery and 1 vein, 2 artery and 1 vein, 1 artery and 1 vein. र यसको करेक्ट आन्सर छ C, 2 arteries and 1 vein. Which of the following is a risk factor of macrosomia? Diabetes mellitus, female fetus, preeclampsia, oligohydramnios. र यसको करेक्ट आन्सर छ ए डायबिटिज मेलाइटस. Which of the following is not absorbable suture? Catgut, polyamide, polyglactin, polyester. र यसको करेक्ट आन्सर छ डी polyester. Random sampling or probability sampling includes all the following techniques except simple random sampling, stratified random sampling, cluster sampling, purposive sampling. र यसको करेक्ट आन्सर छ डी purposive sampling. Probability values fall on a scale between -1 to +1, 0 and 1, -3 to +3, 0.05 to 0.01. र यसको करेक्ट आन्सर छ बी 0 and 1. Rose classified 5 stages of which of the following? Schizophrenia, delusion, death, none. र यसको करेक्ट आन्सर छ सी डेथ. A 3-year-old girl has normal developmental milestone with delay in speech. She has difficulty in concentration, communication, and relating to others, and does not make friends but plays with herself. Likely diagnosis is ADHD, autism, specific learning disorder, mental retardation. And the correct answer is B, autism. IQ of 70 to 75 denotes borderline mental retardation, moderate mental retardation, severe mental retardation, normal intelligence. र यसको करेक्ट आन्सर छ ए borderline mental retardation. Content of sodium in ringer lactate is 154 MEq per liter, 12 MEq per liter, 130 MEq per liter, 145 MEq per liter. र यसको करेक्ट आन्सर छ सी 130 MEq per liter. Using a particular code, HILTON is encrypted as ISDLNO. Choose the right option for billion coded in the same form. IBLLION, IBOILLN, IBLLOIN, IBLOILN. यसमा चाहिँ के गरिएको छ भन्दाखेरि चाहिँ दुईटा अल्फाबेटलाई चाहिँ अगाडि पछाडि के HI लाई IH हैन LT लाई TL ON लाई NO गरेको छ. त्यसै गरी बिलियन को चाहिँ IB अनि LL को LL लाई हुन्छ, IO को OI अनि N को NA हुन्छ. त्यही भएर हाम्रो आन्सर चाहिँ C हुन्छ, IBLLOIN चाहिँ हुन्छ. If bird is called a pen, pen is called ear, ear is called whale, whale is called car, car is called sky. From where one can draw water, whale, sky, car, pen. र यसको हाम्रो आन्सर चाहिँ के हुन्छ भन्दाखेरि चाहिँ कार हुन्छ, किनभने यहाँ अलरेडी भनेको छ whale is called car भनेर चाहिँ भनिसकिएको छ. त्यही भएर हाम्रो आन्सर चाहिँ कार हुन्छ. If blue is called green, green is called yellow, yellow is called red, red is called brown, and brown is called pink, then what is the color of the blood? Red, brown, pink, yellow. यो पनि अघि जस्तै गरी नै हामीले सोलुसन गर्ने हो. यसमा पनि ब्राउन रेडलाई चाहिँ ब्राउन भनिएको छ. त्यही भएर हाम्रो आन्सर चाहिँ बी ब्राउन हुन्छ. If RAM is equal to 35, then SAM equal to what? 66, 330, 490 छ. अनि चाहिँ कसरी गर्ने भन्दाखेरि चाहिँ हाम्रो अघि जस्तै अल्फाबेटिकल अनुसारै गर्ने हो. जस्तै गरी ए चाहिँ 1 मा पर्छ भने ए चाहिँ 1 मा पर्छ नि, त्यसै गरी जाने हो. अनि हाम्रो एस चाहिँ 19 मा पर्छ, एच 8 मा पर्छ, वाई 25 मा पर्छ र ए चाहिँ 1 मा पर्यो. त्यसै गरी एम चाहिँ 13 मा पर्छ. अनि यसलाई चाहिँ टोटल कति आउँछ त हाम्रो टोटल गर्ने. त्यो गर्दाखेरि चाहिँ हाम्रो हैन 19 + 8 + 25 + 1 + 13 गर्दाखेरि चाहिँ हाम्रो 66 आउँछ. अनि त्यो 66 ले चाहिँ यहाँ हाम्रो 5 वटा अल्फाबेट छ नि, त्यही भएर हामीले चाहिँ 5 ले मल्टिप्लाई गर्ने. 66 * 5 गर्दाखेरि चाहिँ 330 आउँछ. त्यसै भएर चाहिँ हाम्रो आन्सर चाहिँ स्यामको चाहिँ 330 आउँछ. Salaries of Ravi and Sumit are in the ratio 2:3. If the salary of each is increased by ₹4,000, the new ratio becomes 40:57. What is Sumit's salary? 17,000, 20,000, 25,500, 38,000. र यसको करेक्ट आन्सर छ डी 38,000. यसमा चाहिँ मैले 45 मात्र क्वेसन राखेको छु. मेरो बाँकी भिडियोहरू पनि बिएनएस इन्ट्रान्सको चाहिँ मैले बनाएको छु, त्यो पनि हेर्न नभुल्नु होला, किनभने मैले हरेक भिडियोमा चाहिँ छुट्टा क्वेसनहरू राखेको छु. त्यसै गरी यदि तपाईँ मेरो च्यानलमा नयाँ हुनुहुन्छ भने प्लिज सब्सक्राइब गर्नु होला. त्यसै गरी यो भिडियोलाई लाइक र सेयर गर्न नभुल्नु होला. त्यसै गरी मेरो केही सुधार्नु छ भने प्लिज कमेन्ट बक्समा लेखिदिनु होला. धन्यवाद.